From StraightSmile Solutions. I'm your friendly orthodontist that answers all your questions. Remember, this is not a substitute for your own dental or medical advice. You need to talk to your own physician, pediatric dentist, or orthodontist specifically about your own specific scenario. But today, StraightSmileSolutions.com, we're talking about headgear. And the big question today that I get asked a lot is headgear bad? Does headgear work? Why are some orthodontists using headgear and some orthodontists refuse to use headgear? So let me tell you a little bit about headgear and what it has been used for historically and how things are changing now. How orthodontists and dentists and even pediatricians are thinking way outside the box and realizing that there's better ways to meet these objectives. So historically, headgear has been around for hundreds of years. Headgear is basically, in this case, I would call this quote unquote neck gear in this picture. I know that's not what we call it. In orthodontics, we call it cervical headgear. That means goes around your neck. There's also different forms of headgear. There's ones that go over the top of your head. And don't mind me, I used to love headgear. I used to do it all the time as an orthodontist. I loved it so much that when I was 8 years old, I made my own headgear out of paper clips and now and laters, and I wore it to school because I wanted headgear so badly. So the fact that I'm even talking about this to thousands of people all over the world is pretty cool. Because you know what? Let me tell you all about headgear. Let me tell you how I'm a reformed headgear orthodontist, and I would never, ever, in most situations, use it now, and why. So headgear is used for overjet. Overjet is what patients often call overbite. Gets confusing. Two different terms. The way you all use them and the way orthodontists use them is different. So I'm going to speak your language today, and I'm going to say when the front teeth are more ahead of the lower teeth, okay? So when the top teeth are more ahead of the lower teeth, we want to try to get the jaws to match up a little bit more. Why does this happen? It could be all one of many different reasons. It could be genetics. Maybe Overjet's small lower jaws run in your family. Okay, well, some people say you can't change nature, but you totally can if you start early. So the earlier you start with these things, the better. I'm talking like 4, 5, 6 getting started. I'm not talking 12, okay? So you do not need to wait for your family dentist to refer you to an orthodontist to get these problems addressed. If your family dentist is not referring you, you are welcome to make your own appointment with a friendly orthodontist near you. And if you don't get the answer you're looking for and it's not feeling good in the pit of your stomach, first of all, you're welcome to reach out to me at any time, StraightSmileSolutions.com. You can go to my webpage, you can go to the patient webpage and just get tons of information about different topics. You're also welcome to ask questions. I'm not a substitute and my team's not a substitute for medical advice, but we'll tell you not about your own particular situation, but we'll tell you about different options out there and how they're used. And we can also help to direct you to a very friendly orthodontist near you who specializes in growth and development and believes in airways and believes in correcting bites the right way. And we will find you that orthodontist if you need one. So don't worry about that. Give us that job. We don't earn any commission for this. This is just a gift that we give to the community to help you out because we believe in this. So let me digress. Let me go back to headgear. Why is headgear quote unquote bad? Because what it's doing is it's pulling those top teeth and restricting the growth of the top jaw, which is your maxilla. Well, your top jaw or your maxilla is extremely important. It's connected to your airway, your nose, and all of that. So if you're restricting the growth of that, a lot of not so good things can happen long term with the growth of your face, the shape of your face, the amount of air that can go in, the space for your tongue to go so that you can swallow correctly. This can affect all kinds of health issues later, okay? As well as the way you feel, the way you sleep. So we as orthodontists collectively, many of us are evolving and we're stepping away from using headgear to fix an overjet, and we're moving towards all sorts of other systems to correct it that don't involve restricting the growth, that actually encourage, go think the other way. If you have an overjet and your upper jaw is ahead of your lower jaw, let's encourage the lower jaw to grow instead, right? Everybody wants a nice full profile, full lips, right? Now there's a few situations, and of course your orthodontist will measure to see what's right, where sometimes headgear is necessary, but I would say it's very few and far between. So if your child's been prescribed headgear, I would recommend a second opinion. Learn a little bit more, get a second, a third, a fourth opinion. And if you are looking for an airway-friendly orthodontist near you, hashtag airway-friendly braces, hashtag airway-friendly aligners, message me at our team, StraightSmileSolutions.com. And if your family dentist isn't getting this or has questions or seems to want to know more, not all dentists know everything. So please do send them to StraightSmileSolutions.com and we will talk to every single dentist out there to educate them about options. Anyways, have a great day. Message us soon. Let us know what you want to learn. Take care.